Hi everyone, welcome to our meeting. My name is Ryan Crawford and my purpose in this meeting is to discuss Jackson's current level of present functioning, the intervention created for Jackson, results of the intervention, and my recommendations for his future programming based on the data taken from the study today. Jackson is a 3-year-old boy who was recently diagnosed with autism by his homeschool's evaluation team. He started school for the first time in September of this year and is in the self-contained pre-K autism classroom. His IQ is untested and has no previous formal education experience as he just turned 3. Interviews and preference assessments have been done with Jackson and the family, as well as the educational team, to determine highly preferred items. These items include the iPad, toy cars, crunchy snacks such as chips, and sensory light toys. As determined by the team, the 2 target skills to be worked on at this time are eye contact and hand still. These 2 have been chosen as a priority as they are the building blocks and foundation of learning readiness skills. Currently, Jackson makes eye contact in 5% of occurrences of adults talking to him. Jackson often seems distracted easily and does not maintain attention to the speaker or non-preferred items for more than 1 second at a time. While seated in a one-to-one or group setting, he engages in hand-flapping behavior. He often reaches out and grabs or swipes at anything at the table in front of him. He takes items off the table at inappropriate times, especially when these items are preferred. For this study, we used a multiple baseline across behaviors design. For the intervention, we used the Peak Relational Training System. Both skills will be assessed without intervention or reinforcement, which will be the baseline phase. Once baseline for eye contact was stable, the intervention for eye contact was introduced. After the first skill was under intervention phase, the second skill was removed from baseline and given the intervention. For the baseline procedure, Jackson was instructed to sit in the classroom's one-to-one direct instruction area. This area was behind dividers as to reduce distractions. 5 trials of baseline were completed. During these trials, the staff would present a stimuli including look at me or hand still, a total of 5 times each. Each skill was worked on in different trials. If Jackson completed the request, he was given verbal praise. During the intervention, Jackson worked in the same direct instruction area. The first skill worked on in intervention was eye contact. Staff presented a verbal prompt saying, "Look at me." If Jackson maintained eye contact for 2 seconds, he was reinforced with a crunchy snack. If there was an incorrect or no response within 3 seconds, "Look at me" was represented with a prompt. This continued until a correct answer was given. Once the eye contact lesson intervention was underway for 3 trials, staff began the hand still lesson. Staff presented a book on the table in front of Jackson. Staff instructed him to put his hands on the table and said, "Hand still." If correct, Jackson was reinforced with a crunchy snack. If an incorrect or no response was given within 3 seconds, hand still was represented with a prompt. This continued until a correct answer was given. The Peak Relational Training scored as followed. 10 marked independent accuracy with no prompt. 8 is 1 single prompt was needed. 4 was 2 prompts. 2 is multiple prompts or reduced stimulus array produced a correct response, or 0 was no response after multiple attempts. As seen in the data, the baselines remained at a low, stable rate until the intervention was introduced. Experimental control is shown in this study as the baseline for behavior number 2 remained at a low, stable rate, while behavior number 1 had a positively increasing trend once the intervention was put into place. For the eye contact lesson, Jackson scored 0 on all baseline trials. Once the intervention was in place, he rapidly increased his peak score, even independently following the cue, "Look at me," and holding eye contact for 2 seconds in the final 2 trials. Similar to the first behavior measured, a low stable baseline was achieved in hand still. Jackson showed no response to the hand still prompt during baseline. Once intervention was introduced, his responding increased in an upward trend for all intervention trials. Overall, Jackson showed great improvement using the peak training model. Both behaviors improved from a level of no responding to independent or near independent, correct responding for both behaviors. The multiple baseline across behaviors design showed that the intervention was the causal agent in the improvement of both behaviors selected by Jackson's educational team. Based on the data presented today and the positive impact this intervention had on his target skills, including hand still and eye contact, the educational team should continue to use the PEAK relational training module to increase other skills. Both learned skills should be worked into the rest of the school day in order to promote maintenance and generalization of all target skills. Thank you for coming to the meeting today.